We want to keep access to care uniform throughout. And how do we identify patient populations who maybe have social risk factors or what we now label as social determinants of health that we can identify as needs to be addressed. So our care teams, our social workers have worked to get a section on our acute side documentation and our ambulatory documentation that shares data across. So, you're an outpatient seeing a doc for a primary care visit, and then unfortunately you end up getting admitted to the hospital. We have that kind of story flowing between both worlds. And, having that data available to prompt providers to put maybe a code in there saying this patient has transportation issues, or this patient is concerned about getting all of their medications paid for, or they're in a financial strain situation. If we have that code placed in there, we can use that to talk to some of our registries, talk to some of our dashboards, where we're able to pull that information and actually identify that on, our care team manager can call this list of patients and make sure they have rides squared away for their visits so they're not missing appointments, and those no-show rates aren't, down in the gutters, so to speak.